Good day, everyone. Today we're going to talk about treatment choice for diabetic macular edema. First, we have to know what is macular edema. Well, macular edema develops when blood vessels in the retina are leaking fluids. Now we have a video about that will explain better.
We explain diabetic macular edema. Meet Joe. Joe was diagnosed with diabetes 3 years ago. Since then, he's had to make changes to his lifestyle. Joe has been bombarded with information about the ways his diabetes could affect other aspects of his health. There are literally hundreds of sources, from leaflets at the clinic and hospital to entire websites devoted to the issue. Joe can't possibly read everything and finds all the advice overwhelming. Due to this information overload, Joe has missed some important stuff. He may not even know that he could suffer vision deterioration or even loss if he does not manage his diabetes properly. Vision impairment due to diabetic macular edema, or DME for short, is one of the leading causes of blindness in those suffering from diabetes. DME is a consequence of diabetic retinopathy, the most common diabetic eye complication. DME can lead to significant visual impairment in up to 3% of patients with diabetes. Sight loss is the most feared diabetes-related complication. DME occurs when tiny blood vessels in the eye begin to leak fluid. This fluid causes swelling in the central portion of the retina or macula, which makes vision blurry. Sufferers may also experience image distortion, color or contrast changes, floaters or dark spots in the field of vision called scotomas. It's important to remember that these symptoms don't just happen overnight. It's a chronic condition that can take years to develop. For someone like Joe, visual impairment can hugely affect his everyday life, from managing his diabetic medications to preventing him from being able to drive or even work. And if left untreated, he could even lose his sight. Joe should visit his ophthalmologist on a regular basis. While there are treatments for visual impairment due to DME available, the best form of prevention for Joe is to manage his blood sugar levels carefully and effectively. Pay attention to other risk factors such as his diet and weight, and of course, take regular cardiovascular exercise. If Joe begins to experience any of the symptoms of visual impairment due to DME, a retinal specialist will be able to recommend the right treatment for him to ensure Joe retains a high vision-related quality of life.
Diabetic macular edema is a common cause of vision loss in patients with diabetes. Chronic elevation of serum glucose levels leads to capillary damage that results in microaneurysm formation in the retina. Leakage from this microaneurysm leads to vision loss if the fluid involves the center of the fovea. Result from clinical trials of drug that blocks vascular endothelial growth factor (VEGF) for the treatment of diabetic macular edema have led to a dramatic shift away from laser therapy to primary treatment with intravitreal injections of one of these three anti-VEGF drugs, that is, aflibercept, bevacizumab, and ranibizumab. Development of macular edema.
Welcome to the Science of DME, presented by the Angiogenesis Foundation. This animation describes the development of diabetic macular edema and empowers you, as a diabetes patient, to manage your condition. Diabetic macular edema, or DME, develops as a complication of diabetes and is a leading cause of vision loss among working adults. Anyone with type 1 or type 2 diabetes is at risk. Diabetes occurs when the pancreas, a gland between your stomach and your spine, fails to produce adequate levels of insulin or is unable to use the insulin properly. This harms the body's natural ability to control blood glucose levels, which become dangerously high without consistent management. High levels in blood glucose can lead to a number of conditions, including vision-threatening diseases such as diabetic retinopathy and DME. DME can occur at any point in the progression of diabetic retinopathy, so the presence of both conditions must be monitored to prevent vision loss. DME involves the retina, the tissue at the back of the eye that receives and processes what you see, and the macula, which is a small part of the retina critical for seeing clearly. DME occurs when blood vessels leak fluid into the retina and macula, causing edema. Why does this happen? Retinal blood vessels become weak or blocked when blood glucose levels are too high, such as in diabetes patients. The retina cannot receive enough blood or oxygen and sends signals to surrounding tissue for nourishment. VEGF is then released at abnormally high levels. Too much VEGF weakens the vessel wall and makes it more penetrable, so blood vessels become leaky. As the vessels leak fluid and blood into the retina and ultimately the macula swells and thickens. This is the condition known as macular edema. Swelling of the macula causes vision to become blurry. Colors may also look faded or washed out, and spots may appear in your vision if blood has leaked into the eye. These changes are very sudden and usually occur in the late stages of DME when treatment is less effective. Do not wait for symptoms. Anyone with diabetes should have comprehensive eye exams every year or as recommended by their doctor before experiencing any changes in vision. According to the Center for Disease Control and Prevention, up to 50% of diabetes patients do not get their eyes examined or are diagnosed when it is too late for treatment to be effective. If timely treatment is not obtained, DME can lead to severe and even permanent vision loss. Don't let this be you. Get comprehensive eye exams consistently. If DME is found, your eye care specialist may perform other tests to assess the extent of your condition. A fluorescein angiogram may be used to take images of the inside of your eye, and optical coherence tomography, or OCT, is another imaging tool that measures the thickness of your retina. The risk of developing DME increases with the duration of diabetes, as well as abnormal levels in blood glucose, blood pressure, and blood lipids. Other diabetes complications, kidney disease, cardiovascular disease, smoking, obesity, and pregnancy may also increase your risk for DME. You can lower your risk by controlling any modifiable risk factors you may have, managing your diabetes consistently, and of course, getting comprehensive eye exams as often as your doctor determines. If you or a loved one has been diagnosed with DME, learn about your treatment options in the Treat video and know
difference between the injections of the drugs. First, we have the aflibercept. It is better for vision worse than 2015. There were more cardiovascular events in patients treated with ranibizumab. There is such a large difference in cost to patients per dose among bevacizumab. Because it is $50, it is even cheaper than aflibercept, that is the most expensive. Now we have another video of
Welcome to the
DME.
Science of DME, presented by the Angiogenesis Foundation. This animation explains how anti-VEGF treatment can help patients with diabetic macular edema attain the best care and live a higher quality of life. Diabetic macular edema can be treated, and if caught early, vision loss can be delayed, stopped, or in some cases, even reversed. Until recently, DME patients were limited in their treatment options. Focal laser photocoagulation was once the standard treatment for DME. It exposes the eye to small laser burns in order to decrease and slow down leakage of fluid, stabilizing vision and potentially preventing further vision loss. However, it is unlikely to improve vision and comes with the risk of scarring the retina. In cases where too much blood has leaked into the vitreous of the eye, a small surgery called a vitrectomy can improve vision by replacing the vitreous with a salt solution, and therefore removing excess blood. However, this may offer only temporary relief because it does not stop blood vessels from leaking further. Corticosteroids, which are received through intravitreal injection or by sustained-release implants, can improve vision by interfering with the mechanisms that cause inflammation and damage to blood vessels. However, their benefits may be short-lived and come with a risk of other eye complications, such as cataracts or elevated intraocular pressure, which is a major risk factor for glaucoma. A major development in treating vision loss in DME patients has been the introduction of anti-VEGF drugs, which leverage recent advances in our understanding of the different mechanisms that cause DME. Overexpression of the protein VEGF, or vascular endothelial growth factor, has been shown to play a major role in the development of diabetic macular edema. In DME, VEGF is produced at higher than normal amounts in the retina, which causes blood vessels to become weak and leaky. Anti-VEGF drugs are designed to target and block VEGF. Lowering abnormal levels of VEGF reduces harmful effects on blood vessels. This decreases leakage of fluid, reduces edema, and can stabilize or even improve vision, all with lower risk for developing other major eye conditions that are associated with some other treatments. Anti-VEGF treatment is received as an injection directly into the eye. There are three major responses to anti-VEGF treatment. Reduced vascular permeability, so that the vessel wall is not as penetrable and leakage of fluid is minimized or completely stopped. Reduction in edema and decreased thickening of the macula and retina, and as a result, improved vision, with benefits outperforming that of other treatments. Because of its positive results for DME patients and a lower risk for other eye complications, anti-VEGF therapy has become the preferred treatment for DME. If you are diagnosed with DME, you have options. Work with an eye care specialist who is experienced in treating and managing DME, and ask them if anti-VEGF therapy is the best option for you. Knowledge and understanding of your condition empowers you to take an active role in choosing and managing your treatment. Visit the Science of DME.
So, what we have to consider? That there are powerful forces in addition to efficacy and safety that affect drug selection by physicians. These include the current requirement for a patient-specific prescription, which limits or delays access to compound bevacizumab in some states. The rebates paid directly to the physicians from pharmaceutical companies to reward use of a more expensive drug. How the patient feels the diabetic macular edema.
Well, my name's Janelle Cahoon and I'm an Australian, born in Brisbane, before then getting a full-time job with the Australian Opera and then travelling to Frankfurt and singing with the Frankfurt Opera before going blind from the complications of diabetes, which I'd had since I was age 10 and was ignoring most of the time, pretending I didn't have it, hiding it so I didn't lose my job. I was fully aware that diabetes could lead to blindness, but that would happen to someone else. And he said to me, if you don't get better control of your diabetes, you'll be dead by the time you're 30. And I'm, okay, so if I'm going to be dead, I'm going to be dead, no worries. That's the way you think when you're a 17-year-old. I'm just going to go out and party really hard. I'm going to push everything to the limit. I'm going to travel the world like I want to do. I'm going to pursue this career as an opera singer that I really want to do. He didn't say you're going to reach 30 and you're going to start suffering. You're going to go blind. Then your kidneys are going to fail. You're going to have all sorts of neuropathies. You're going to have other diabetes complications. It's going to completely ruin your life, so to speak, with the career, with the travelling, with the independence. And going blind at the age of 29, that took away my career, which was so important to me. It took away my independence. It took away driving my car around Europe, travelling. I was suicidal. I was depressed. I was angry. I was frustrated. They then just said, well, you'll need this scatter laser treatment. Just putting your chin on this headrest and having someone playing Space Invaders with your eyes, just shooting the back of your eye. And some of them weren't too painful and some of them were unbelievably just snap your head back. Once it's settled down, come back in a month, we'll check into, but we'll have to book you in for surgery because they can't do laser treatment right over the macula. I think overall the doctors could have done a lot better job in a lot of areas. On the other hand, I think they were brilliant. Like, I know they were trying their best. I know because I know my friend said, you know, when they go home at night, Janelle, they're not thinking about you and the pain you're going through. And I said, I think they are actually. There's now an injection rather than laser treatment, for one thing, is huge. Of course, I think there's going to be people who, the idea of an injection in your eyeball is horrendous, and I would have thought the same thing. So I think it's going to be a case of doctors really stressing that, you know, that laser treatment is painful. It doesn't work anywhere near as well. Go for the injection in your eye. I think everyone should be educated about DME. They think of it still as someone elderly will go blind, and they're not really focusing on that it can happen to really young people. The thing is that a lot of people aren't putting the patient at the centre. It should also be including the patient from the beginning.
And then we have another treatments for diabetic macular edema.
For macular edema, the laser is focused on the retina outside the center of the macula. The laser is not applied directly to the center of the macula, since this would reduce central vision. The main goal of treatment is to prevent more vision loss by sealing off leaking blood vessels that interfere with the proper function of the macula.
Thank you.